Hello, everyone. Thank you for joining us for today's webinar. My name is Myra Chen, and I'm your host and moderator for today's eLotus webinar. Here at eLotus, we have been hosting educational courses for over 2 decades, and we are proud to be your trusted source for premium CEU content with over 200 speakers, 700 courses, and 3,000 hours of CEUs. We have 3 groups of attendees with us today. Firstly, a warm welcome to Group 1, our paid attendees. If you've registered and paid for today's class, you'll have the opportunity to access and review the course material for the next 4 weeks, earning CEUs along the way. Next up, we extend a hearty welcome to the Watch It Free group. If you signed up for today's class at no cost, please note that you won't receive CEUs after the session concludes, nor will you have access to the course material for review. However, should you decide that you'd like CEUs or access to the course for review, you're more than welcome to register within the next hour. I'll leave the registration open for you if you'd like to register as a paid attendee or as a Gold Pass member. Last but certainly not least, we're delighted to greet our Gold Pass members. As a Gold Pass member, not only do you gain complimentary access to today's webinar, CEUs, and unlimited review, you also unlock the access to over 3,000 hours of video recordings from 200 different speakers on our platform. For those unfamiliar with the Gold Pass, I'll be sharing a link in the chat room for you to learn more. It truly is the ultimate investment to deepen your knowledge of traditional Chinese medicine and to elevate your practice. If you've been contemplating on joining the Gold Pass community, there's no better time than today. Our Gold Pass webinar special only comes around a few times a year, so this is the best time to register. In addition, our sponsor, Evergreen Herbs, will be providing a gift voucher that is equivalent to the amount you spend on the Gold Pass. Stay tuned for more information later today, as we'll be posting more details about the Gold Pass webinar special. Today's webinar is Enhancing Detoxification Pathways for Infertility with acupuncture, essential oils, herbs, cupping, magnets with Michelle Marimore, sponsored by Evergreen Herbs. Michelle Marimore is the creator of the body feedback style of acupuncture, which uses palpation techniques combined with classical acupuncture point prescriptions, essential oils, Chinese herbs, and nutritional supplements to get to the root of people's health concerns. She is recognized as an innovator in the field of acupuncture for integrating functional medicine into her practice. Michelle has several other courses with us, which you can find on her bio page. I'll send a link in the chat room for you to check out. We are excited to have you here with us. Before we get started with the webinar, let me familiarize you with our webinar room. Please set your chat from host and panelists to everyone. That way everyone can be a part of the conversation. To ask Michelle any questions, please use the Q&A box to ensure the questions remain separate from the chat room. And as a quick reminder, the quiz for CEUs will be available by the next business day, late afternoon, for everyone with qualifying attendance. All right, let's get started with today's webinar and welcome Michelle Marimore.
Thank you very much. Thank you, Myra. Okay, so I can go ahead and take over and share my screen. And so we will get started. Okay, and I will do my best to keep an eye on the chat. Thank you everyone for attending. I appreciate you taking the time out of your weekend for everybody who's here live. And I would like this to be an interactive course. So I will ask for people's input, their experience, and if you have a question at any point in time, you can, if you'd like me to address it right away, you can put it in the webinar chat or in the Q&A. I'll keep an eye on both. And I will go through them on the breaks. So we will have 2 breaks in the morning and then an hour lunch and 2 breaks in the afternoon. So we'll be able to get quite a bit of interaction between us. Okay, so let's get started. Let's see, I'm gonna get my, Okay, so today's class, we are going to discuss the endocrine-disrupting chemicals and how they impact reproductive health. We're going to talk about the 3 phases of detoxification, and this is from a Western perspective. So we're going to be learning a lot about Western anatomy and physiology with respect to detoxification. And then we are going to talk about the 4 primary organs of detoxification from both a Western and a TCM perspective. Then we're going to use pulse and palpation assessment to be able to assess the detoxification organs and figure out where people are struggling and how to support them. And the treatment options are going to be acupuncture, herbs, supplements, cupping, essential oils, and magnets. One of the things I really enjoy doing is actually cupping over people's liver and gallbladder and their reproductive organs. So I don't know anybody else who's doing this kind of a more aggressive cupping. There's one gentleman in Indiana that is teaching cupping, but you guys are going to get to see some pictures. And if we have time, I have a little tiny video clip I could show you too of how I check the cups to make sure they're in the proper position for organ cupping. So that's going to be kind of cool and fun. And you guys will see some new things today. Okay. The classical TCM textbooks do not include information on the toxic effects of endocrine disrupting chemicals. This is something that's more modern pathology. And so we have to look at it from a different perspective. So infertility today requires complex treatment approaches to remove the endocrine disrupting chemicals and then improve reproductive health. TCM pattern identification relies on the symptoms of endocrine disrupting chemical toxicity, which requires treatment in a specific order. So this is one thing that everybody's going to fully grasp by the end of the class is, okay, how do we do it from start to finish in the correct order? Because if it's not done in the correct order, it's just recirculating toxins. And then we're going to talk about pulse and palpation techniques that can test treatment options, including the acupuncture, herbs, supplements, cupping, essential oils, and magnets. We're also going to talk about personal care products and water and possible endocrine disrupting sources. So how many people here, I'm just curious, use palpation techniques to check their points or choose their points? Let me know. Do for sure. Is there, and let me know if you're, okay, good. So sometimes so good. So you guys all have an idea of what I'm talking about when and why we check. Okay, great. So the body feedback system at acupuncture, I created this system. And basically what I did is I used a combination of palpation techniques, classical acupuncture from the Yellow Empress Classic of Medicine, the theory from that, and incorporated it with the Chinese 6-point acupuncture prescriptions, which comes from the Korean 4-point. So it's going to look a little bit like a 5-element approach, but it's to get to the root of the treatment, and it's more traditional Korean 4-point with the extra Chinese 2 points to make it Chinese 6-point point prescriptions. And the illustrations are created by Miroslava Sobat, and the information here is created by me and my intellectual property. Okay, the body feedback style incorporates Chinese pulse diagnosis. So if people are not used to using palpation techniques, you can go use the pulse. And sometimes I like to do a little bit of both. And I'm going to talk about different palpation techniques that we can use. Frequency testing. We can use the acupuncture meridian system to frequency test supplements that we are thinking about using, essential oils. The acupuncture meridian system, each meridian resonates with a particular frequency when it's healthy. And so if it's not healthy, there'll be different alarm points that go off in different areas of the body that will show pain and tightness and tenderness that refers the imbalance or pathology that's in that particular meridian. And then what you can do is you can actually place supplement bottles on the upper abdomen and give the body about 10 to 15 seconds to adjust. And you can feel a shift in the pulse and in the muscle areas. And this is really cool. Has anybody here played with frequency testing supplements on the upper abdomen? And the reason the upper abdomen works, it's because that's like the communication hub for the acupuncture meridian system. It is where all the meridians cross over, and you've got the 6 meridians plus the conception vessel running parallel. And this creates a large area of low electrical resistance where the body can take energy in, and it will adjust the frequency of the meridian system. Okay. So let's see here. And then the acupuncture point prescriptions, they work really well. There's certain rules for using these point prescriptions that we're going to talk about throughout the class, and ways to add additional points. I like to use the point prescriptions for my root treatment. I put those in first, and then I will add as many supporting points or TCM style points that I need to get the results that I'm looking for. So you can use the basic point prescriptions in your style of acupuncture pretty easily. They're made to be adapted. Okay, first thing we're going to do is talk about the common endocrine disrupting chemicals and look at some studies and how it's affecting infertility and women's health. The common endocrine disrupting chemicals that affect fertility are the PFAS, which are pure and polyfluoric alkaline substances. PFAS is how most people refer to them. The BPAs, bisphenol A, PCBs, which is organ chlorine, and phthalates. Studies suggest that exposures to endocrine disrupting chemicals during fetal development causes alterations in the structure and function of the reproductive system, diminishing the next generation's ability to conceive. So this is what's going on is we've got multiple generations now that are exposed to higher levels of endocrine disrupting chemicals. So we're starting to see some pretty complex cases and people that have been suffering quite a bit with their reproductive health. One of the case study demonstrations for cupping later on is a woman who I believe this has happened to, and she's pretty much had a pituitary tumor her whole life and severe PCOS, and she had never had a regular cycle or ovulated in her life until she started seeing me. She's in her 30s. There's a lot we can talk about throughout this class, but she's on her 3rd cycle of ovulating with 35-day cycles. So I'm really excited to share what we did to get her to that point. According to the Endocrine Society, EDCs are associated with common causes of infertility, such as premature ovarian failure, menopause, ovarian dysfunction, endometriosis, polycystic ovarian syndrome, fibroids, and unexplained infertility. One thing that I used to notice when I first started in this field, which was over 20 years ago, I think I've been in practice 22 years now, is that they used to tell women when they had fibroids that eventually they would go away when they went through menopause, but that's not the case anymore. Most women with fibroids today are still struggling after menopause, and some of these people end up with endocrine cancers, and I believe it's because the EDCs, the endocrine disrupting chemicals, are lingering in the reproductive organs for a very long time. PFAS are known as the forever endocrine disrupting chemical, the forever EDC, because they do not disintegrate and continue accumulating in the environment. And remember, what goes on in the environment goes on in people's bodies. So I think this is like our biggest offender right now that we have to be very concerned about. So we're going to talk about PFAS for a little bit. They are used as repellents and coatings for common products, including cookware, carpets, and textiles. So in clothes, that's a big issue we're going to talk about in a little bit. Training exercises using firefighting foam pollute the environment with substantial quantities of PFAS. So is anybody here close to an airport, or do you have airports in your area? If you do, you're probably going to want to look at the water utility company in your area and find out what the level of PFAS are in the wells and the water in your area. In Madison, Wisconsin, we have a smaller airport, but it's also associated with a government airport, and they do a lot of these firefighting exercises, and they've polluted our area quite a bit. So I deal with this with most all my clients and fertility clients for sure. So the PFAS contribute to numerous diseases while compromising, health, in addition to disorders of reproductive and endocrine system. Disorders of the reproductive and endocrine systems. Okay, we got a little typo there. Sorry about that. Manufacturing with PFAS and repeated unnecessary practice drills with firefighting foam have contaminated ground and drinking water. Manufacturing of PFAS began in the 1940s. Today, there are over 5,000 different types of PFAS with some similar attributes and negative health effects. So we are really dealing with a lot of problems with the PFAS. The PFAS mimic fatty acids, which alter the structure of cholesterol and hormones and cause severe adverse health effects. So this is really important to get. All the hormones in the body are made from cholesterol. And when the cholesterol is contaminated with the PFAS, it creates all types of problems for the hormones in the endocrine system. And getting rid of that is a big issue. So studies on the PFOA type of PFAS exposure found a probable link with 6 disease categories, including high cholesterol, thyroid disease, ulcerative colitis, testicular cancer, kidney cancer, and pregnancy-induced hypertension. So you can see this is a lot of our people that are coming in with health concerns or fertility and concerns could be having these other issues too that we need to be aware of. So increased levels of PFAS exposures are associated with reduced fertility in women. This was characterized by a reduction in birth rates and an increase in infertility. This finding partially explains the decline in female fertility and provides insights into risk assessment when manufacturing products containing PFAS. Higher PFAS exposures correspond with later menarche, irregular menstrual cycles, longer cycle length, earlier menopause, and reduced estrogen and androgen levels. So a lot of our clients are going to be coming in with these symptoms. And again, I believe that detoxing is the very first thing you have to do. So PFAS can result in diminishing ovarian reserve and reducing endogenous hormone synthesis. So when the body is trying to make hormones internally, they struggle if there's the PFAS there. Several studies found clinical evidence of PFAS in follicular fluid and their ability to pass through the blood follicle barrier. So this is toxins getting into the eggs, basically, and causing problems, getting into the follicle that holds the egg. And we don't know what type of interaction it's having with the eggs. So you can see that the PFAS are really dangerous here. For men, there is a less direct association between PFAS and infertility. One study shows inconsistent associations between plasma concentration of PFAS, semen quality, and testicular volume. Higher levels of single and combined PFAS were associated with slightly higher follicle-stimulating hormone levels for sperm production. So the guys don't seem to be as affected by the endocrine disrupting chemicals as the women. I do believe if they're exposed to a lot of endocrine disrupting chemicals in utero when men are, or boys, or I guess baby men or male babies are exposed to a high amount of these endocrine disrupting chemicals in utero, I think it does alter their ability to make sperm correctly. And sometimes that's when we'll see really, really low sperm counts with a problem with morphology and motility, and the sperm analysis is just a mess. So that's a whole nother problem there. So now we're going to talk about the BPAs. BPA is used in manufacturing plastics, polycarbonates, epoxy resins, and polyvinyl chloride, PVCs. BPA directly contacts food through plastic packaging, can linings, jar caps, the inner coating of the jar caps, and BPA can enter the body through ingestion, inhalation, and transdermal absorption. So this is a big issue, the transdermal absorption. We're going to talk about a few different times throughout this class, but a lot of the clothes that are manufactured today have BPAs in them. They're in the polyester. And then there's some people who are, some companies that are making clothes from recycled water bottles. And that's the worst, because that's really high levels of chemicals, and BPA specifically, that gets absorbed in through the skin, because the skin is the largest organ of absorption. So unfortunately, I think with a lot of women wearing like the leggings and the workout clothes that are made from plastics or the recycled water bottles, they're just flooding their body with BPA and the endocrine disrupting chemicals. Okay, the primary sources of exposure to BPA include food packaging, indoor dust, dental materials, healthcare equipment, thermal paper, toys, and articles of clothing for children and infants. So a lot of the clothing for infants is made with flame retardant materials, where they add some type of flame retardant to the clothes. And that's a big problem. So then we're just poisoning our kids. Really going with the organic clothing, organic cotton clothing is the best thing that we can do. I use a lot of Maggie's organic products, and they will allow acupuncturists to have wholesale accounts. So if you're looking for a way to provide some access to organic cotton clothing for your clients, you can always look at Maggie's Organics. BPA plays a role in the pathogenesis of several endocrine disorders, including female and male infertility, precocious puberty, hormone-dependent tumors such as breast and prostate cancer, several metabolic disorders, including polycystic ovarian syndrome. So a lot of people with PCOS have compromised detoxification pathways, and that's genetic. PCOS is known to be a genetic condition. So if a person's mother or sister or female family member has PCOS, they're much more inclined to get PCOS. But I think a lot of it is these detoxification pathways that are altered. With assisted reproductive procedures, BPA exposure negatively impacts peak serum estradiol levels during the gonadotropin stimulation and the number of retrieved and fertilized oocytes and implantation. So they're starting to look at some of the failures with IVF, and there's studies that are coming out associating it with the BPA. Just checking in, make sure there's no questions. A review of studies from 2007 to 2016 focused on fertility outcomes and organs important for female reproduction and reproductive related processes. And they found that BPA may be associated with infertility in women by affecting the morphology and function of the oviduct, the uterus, the ovary, and the hypothalamus pituitary ovarian axis, as seen in animal models. BPA may also disrupt estrogen cycles and implantation. So we can see this is a real problem here. In men, the effects of BPA exposure on fertility are controversial. So some studies report decreased sperm quality, sperm concentration, and total sperm count, while others report no adverse effects. And I just think that that is a result of how the men's detoxification pathways are working. And they're not as burdened because they don't have as much estrogen in their body to grab onto the endocrine disrupting chemicals. Findings from animal model studies and in vitro experiments have shown that BPA reduce sperm quality and increase sperm DNA fragmentation and oxidative stress. So there are some studies showing that there's a thing. So we've got two questions here. Is BPA phased out of all plastic materials? No, BPA is still used today all the time. Organic cotton is safest for clothing. Anything else? Wool, cashmere, anything less synthetic. Yep. So some of the like newer fabrics, like the modal cotton, actually has some synthetic in it, some polyester. So you have to be careful with that. I think organic cotton is just the easiest way to go. And they are not phasing out the BPA at all. And let's see here. BPA was injected into pregnant mice at different doses. BPA disrupted the secretion of testosterone, estradiol, and estrogen receptors by interfering with the transcription of testicular DNA, methyltransferases, DNMT, and offspring males. So we can see that when they're exposed to BPA in pregnancy, it definitely affects the next generation's fertility for men. So BPA damaged testicular tissues and BPA damaged testicular tissues and affected the potential reproductive function. So we're starting to see that. Also, too, sheets make a big difference for people. So I like to use cotton sheets, and organic cotton sheets are best. And then there's an issue with bamboo sheets. Some people are trying to like move to bamboo, and that's always mixed with polyesters, and they usually have the BPAs in there too. Does reverse osmosis remove PFAS? It doesn't. We're going to talk a lot about water throughout this class, and I'm going to show you guys where you can find what types of water filters work for you in your area. So water is a big issue. We're going to talk about that a lot today. PCBs, they belong to a group of chemicals known as chlorinated hydrocarbons. They were manufactured in the United States from 1929, and they were banned in 1979. So this is the only family or group of chemicals that we're talking about today that's been banned. However, they still circulate in the environment today. Due to their non-flammability, chemical stability, and high boiling point, and electrical insulating properties, hundreds of industrial and commercial applications utilized PCBs. So the problem is, if you're living in a house that was built before 1979, or you're working in a building that was built before 1979, there's probably PCBs in the all the different materials that was used to build the buildings, and then that ends up in the dust, and then it circulates through the vents, and so you can get it through house dust. Whoops. So, phthalates. Phthalates occur in products containing PVC resins, including vinyl, upholstery, shower curtains, food containers, wrappers, toys, tiles, lubricants, sealers, and adhesives. Phthalates can also be found in perfume, cosmetics, eyeshadow, moisturizer, nail polish, hairspray, liquid soap, and pesticides. Phthalates are like everywhere, so this is a big problem here. They are easily released from products into the environment as they degrade. Phthalates naturally degrade outdoors and do not persist in the environment. So one good thing is they're not the forever chemicals, but a problem is they're everywhere. So we're going to talk about the effects of EDCs on female infertility. So BPAs will decrease estradiol levels. PCBs diminish anti-Müllerian hormone concentrations, which is it's a test that they use, the AMH test, to look at ovarian reserve, and PCBs will diminish the ovarian reserve. BPAs, parabens, and phthalates reduced antral follicle count. BPAs, triclosan, phthalates, and PCBs diminished oocyte quality, which is egg quality. PFCs and PCBs lowered fertilization rates. BPAs, phthalates, and PCBs decreased implantation rates. Triclosan, PCBs, and BPAs reduced embryo quality. So there's quite a bit of studies that are showing us how dangerous all these chemicals are for fertility. Parabens and phthalates lowered the rate of clinical pregnancies and live births. And the above results show that exposure to EDCs impacts women's reproductive potential, measured by ovarian reserve and assisted reproductive technology outcomes. So if you guys ever want more information on the science behind this, you can always just look at the citations there. Let's see what we have in the chat or questions. So my understanding is that BPA is found in clothes that contain spandex and not all polyester clothing. So I think it's in a lot more polyester clothing than we realize. Polyester that was really old from the 70s and 80s, I don't think had the level of BPAs and chemicals in it. So what I do is you can take your fingers, if they're clean, they should be tacky, right? What I do often is I'll take a piece of fabric and I'll rub it between my fingers, and then I'll go back and see, does my finger stay tacky or not? And that's one of the things that I'll use to kind of get an idea of, is there some type of either film on the clothes from the materials people are using to wash their clothes with, like laundry soap, or hopefully nobody uses dryer sheets, but you'd be surprised that clients are still using dryer sheets. And the dryer sheets are mostly endocrine disrupting chemicals, and it's just putting a whole layer of them on the inside of their clothes. So sometimes what I'll do is I'll grab, and everybody should do this, especially if you're wearing polyester, is make sure your fingers are kind of tacky and clean, and then grab your piece of clothing and just run it between your fingers like this, and then come back and see, is it slippery or is it still tacky? Because you can feel the film and it'll make your fingertips actually very slippery. So when we're on break, I would like everybody to grab some of your clothing that you think might have BPAs in it, and do that little finger test. I'm curious if you guys can feel it too. And I teach people or my clients to go home and check that. And then there's also a way to check the clothing, to use the body feedback testing methods. I can tell people about the science behind this and tell them how bad it is. And a lot of them, like, they don't want to change their clothing, but then I'll have them bring their clothing in, and I'll actually use the body feedback testing methods, and I'll have them change out of their clothes, make sure they're wearing, if they have cotton underwear and bras, and come in and use like half sheets, and then take their clothes, put them on their abdomen after the end of their acupuncture, and retest their master points in the shoulder and the neck. And I'll let the clients actually feel how their body is responding to the clothes when I place it on their upper abdomen. And that is the easiest way I've gotten people to change their wardrobes. And I'll tell them to, if they don't have a lot of money, I'll tell them to go to like the thrift stores and just look for all 100% cotton, or as close as you can get, 90, 95% cotton clothing. Or I will let them look at the Maggie's Organics and give them a discount on their organic clothing order. That's the best way to actually get people to understand how their clothing is affecting them. So the 7th generation dryer sheets don't have chemicals in them. They're really good. The 7th generation doesn't. So you should be good there. Okay. So now we're going to talk about endocrine disrupting chemicals and TCM pathology. Let me grab a sip of water here. So at first, endocrine disrupting chemicals cause an excess type pathology. The ones that you'll see is blood stasis, and we'll see that with endometriosis, menstrual clots, brown spotting before the menstrual period, fixed pain with menses, and headaches. So if you think about endocrine disrupting chemicals lingering in the environment forever, like the PFAS and the BPAs, when they get in the body, if the body has compromised detoxification, those chemicals linger and linger. And I believe they can linger for forever, basically, if they get stuck in the receptor sites. So the hormone receptor sites in a cell, especially the ones, with the reproductive organs, but it does affect other cells too. The endocrine disrupting chemical looks like estrogen, and then it goes into the receptor site to try and get into the cell, and it gets clogged, and it clogs the receptor sites. It's like now the cells have plastic in them, right? So now the hormones can't get into the cell, and the cell will start to look deficient of hormones, and we'll start to get like deficiency patterns. But at first, and what's really lingering is the excess pathology and these different stagnations. So we've got blood stasis, then blood heat. Blood heat is seen with excessive bleeding, bright red bleeding, red spotting before the menstrual period, and headaches before the period. Also damp heat, especially because the endocrine disrupting chemicals alter cholesterol in the body, and then the liver has a really hard time dealing with that. So then they'll end up with damp heat pathology. We see that a lot with PCOS. Actually, PCOS has the first 3 excess pathologies in it pretty profoundly. So we have the damp heat, which we could see loose stools or constipation before or during the menstrual period, viscous blood, and stringy clots. Sometimes women, when they have their menstrual period, they'll have more chunky fixed clots that, stay together. And that's more the blood stasis type of clot. The viscous blood, it almost puts like a damp coating in the blood where it's shiny and the blood looks coagulated, and it's like a thicker blood and it's shiny. So whenever I'm talking with women about their menstrual periods and assessing the blood quality, I always ask them if they had clots. Are they more like the chunky type, or is it more long and stringy and shiny? And that's how you know if there's some damp heat involvement there too. Toxic heat, we've got abnormal cell growth and neurological symptoms. So this is when it's starting to be a real problem for the person. We've got the toxins and the excess pathologies creating toxic heat, which is leading to all the endocrine cancers and the big growth in endocrine cancer. We're just going to talk about this for 1 minute here. all the women's bras today are made with those BPA chemicals. Like they have the padding in the bras. It's so hard to find organic cotton bras. There's a few manufacturers that are starting to manufacture them because I believe that the endocrine disrupting chemicals in the bras is fueling breast cancer at just a real aggressive rate, and especially with younger women, because that tissue is just absorbing in the chemicals from the bras. So that is one thing that I work with anybody who's got breast cancer. They always are using bras full of those chemicals, and you can feel it in the bra. Then we've got another excess type of pathology. We've got cysts, PCOS, hard masses, and reproductive tumors. So this is kind of the first stage of what happens in the body from a TCM perspective with the endocrine disrupting chemicals. Let's see if there's any questions here. I do believe there's an increase in autism rates. I was just talking to my husband about that this morning. I just read somewhere that it's now, they're saying 1 in every 36 babies that are born are on the spectrum. So 1 in 36, that's just really a shame. So what kind of sheets are you using on my treatment table? Mine are totally mixed with synthetic crap. Yeah, so I use just 100% cotton sheets on my treatment tables, and I wash them. I'm lucky to have a office in my lower level of my house. I have, like, my clinic is in this space here. So it's really easy for me to wash the sheets. But I just go and buy them on sale at the like Macy's or any of the big box stores, and just get like a 550 count just regular cotton sheets. I don't get organic cotton sheets for my treatment tables. I think regular cotton is good enough. Okay. And then, so endocrine disrupting chemicals clog the cellular hormone receptor sites, creating the excess pathology. So that's the first step. And then the cells slowly become starved of healthy hormones, and they cause signs and symptoms of low hormones. How long do the receptor sites become clogged? Well, it depends on the detoxification pathways, genetics, and the length of exposure. Exposure during fetal development and puberty can cause abnormal gland and organ development. So unfortunately, this is what we're starting to see in these generations that are coming into puberty and in their early 20s, is they're not cycling right, and they have PCOS, and they might have other issues, like my one client with the pituitary tumor in addition to PCOS. And it's really challenging to make progress here, but I've done it with a few clients, and those are the case studies that we're going to use today. I picked from my most challenging case studies to share those with you today, because the ones that are less challenging than that are pretty easy, and you'll see success really quickly. And if people are trying to get pregnant, their cycles will shift, and most of them will conceive pretty quickly. So it's just these really complex cases we're going to look at today here, because I figured you could handle anything under that. And again, what happens too is when the cells get clogged with the endocrine disrupting chemicals, if the immune system is starting to recognize that as a foreign substance and that there's some damage to the cell, it can create autoimmune conditions. So I believe that the immune system likes to attack the endocrine system, and there's a lot of autoimmune endocrine disorders that go undiagnosed. And I believe that a lot of them are initially triggered from all the chemicals in our environment, these EDCs. So this techniques we're going to use to detox that, I use with all my clients that have autoimmune conditions, and then go from there. So I also have a class on autoimmune disorders too, if anybody's interested in that. But this detoxification work is what always has to happen first. So then over time, if the endocrine disrupting chemicals are not detoxified and released, they cause a combination of excess and deficiency symptoms. We could have elevated FSH, which signals early menopause and premature ovarian failure. We can end up with low estradiol levels, which that in turn elevates the FSH, causing premature ovarian failure. We have low AMH, again, indicating premature ovarian failure. Elevated AMH, which is PCOS. Oops. Sorry about that. And then it went somewhere. Okay, sorry about that, guys. So we have the elevated AMH, which indicates PCOS, and then LH pathway dysfunction, which is elevated DHEA, testosterone or prolactin, and low progesterone. This is what I'm seeing a lot of. This is a cause of unexplained infertility often if the person doesn't have a PCOS type diagnosis, but it's an alteration in the LH pathways. And this is where we're seeing the really low progesterone. And some women will have the elevated prolactin or elevated male hormones. And this is something we're going to talk about throughout this class and how to correct it with acupuncture and what meridians work with the LH pathways. And then we see hypothalamus pituitary axis dysfunction. This is the biggest, I think, influence to unexplained infertility also. And that's usually causes the LH pathway dysfunction too. So having the hypothalamus pituitary axis be off. And so how do we move this information from Western medicine into TCM is what we're going to spend the day doing. So the life cycle of a hormone, the hypothalamus pituitary axis signals follicle stimulating and luteinizing hormones to the downstream hormone production of estrogen, progesterone, and testosterone. These are all fat soluble lipid based products. So the FSH, the follicle stimulating hormone, and the LH, the luteinizing hormones, they basically trigger those other downstream hormones. And then cellular absorption occurs through the receptor sites in the membrane. There's utilization that transforms hormones into used metabolites. And then used hormone metabolites are changed to water-soluble molecules for removal from the cell and excretion from the body. So now we're going to go through this one more time here real quick. So in the head, the hypothalamus pituitary axis says, okay, we need to make these hormones, and it makes them from cholesterol. Remember, if the endocrine disrupting chemicals have altered the cholesterol, then the hormones that are getting made are going to be not so good quality. They're going to be, I think, a little bit compromised. Then you have cellular absorption through the receptor sites in the membrane. And now we know that the endocrine disrupting chemicals can clog that. And I think forever. I don't know if anybody really knows how long it is, but if they linger in the environment forever, why wouldn't they linger in the cells forever? So then we've got the EDCs blocking that cellular absorption. So then if the body tries to actually use the EDC, the endocrine disrupting chemical, to fulfill the needs of the hormone. So let's just take, for instance, building of the uterine lining. So if the body is in the uterine lining is grabbing onto those estrogen molecules to build the uterine lining, and it's grabbing onto endocrine disrupting chemicals, that uterine lining is not going to be good quality. It's actually going to be toxic. And then that's where you're going to see more of the blood stasis and excess type pathologies is in the uterine lining. And that's how you can kind of get an idea of how toxic a person might be, is what their periods are like and what their uterine lining is like. So that cell uses up the estrogen to do whatever it needs to do. And then it's supposed to change it from a fat soluble molecule to now a water soluble one to remove it from the cell and get it out of the body. So this is the main Western pathways that we are going to be going into detail in next, to understand how, from a Western perspective, these processes occur. Because this is where we're gonna link it up with TCM, and we're going to start to look at it from a TCM perspective. Okay, do I have any questions? Have you met any research connecting autism with? I haven't really researched too much on that, but I'm certain it does. There's okay. Let's see here. Okay, we still have a little bit more time. So detoxification of used hormone metabolites. The detoxification phases 1 and 2 converts the molecule from fat soluble to water soluble inside the cell. Then phase 3 transports the water soluble molecules from the cells into the interstitial fluid, where they are removed via stool, urine, and sweat. Used hormone metabolites are released from the colon, kidneys, and the skin, and urine too. Let's chat out of the way. Yeah, they come out through the urine and the stool. So genetics, environmental factors, and nutrition strongly affect the detoxification phases. So detoxification phases 1 and 2, think of converting from fat soluble to water soluble within the cell. Then phase 3 is pulling it out of the cell into the interstitial fluids. And then the body grabs it, releases it from the colon, kidneys, bladder, and skin. So this is where we're going to start to look at how we support those organs and those functions with TCM. Detoxification pathways for estrogen also remove the endocrine-disrupting chemicals, the BPA, the PFAS, the PCBs, the parabens, and phthalates. So we can see the key to supporting how to get these chemicals out of the body is to support the regular estrogen detoxification pathways. Xenobiotics, including medications, drugs, pesticides, cosmetics, flavorings, fragrances, food additives, industrial chemicals, and environmental pollutants, also go along this estrogen pathway. And so does caffeine. So if you have clients that are caffeine sensitive and have issues with when they drink caffeinated beverages, or even have too much dark chocolate, they usually have an issue with their detoxification pathways for estrogen. So the detoxification pathways for progesterone, cortisol, and testosterone, those also control bile production and other aspects of digestion. So we can see the liver is where most of the detoxification for estrogen occurs, and for progesterone, cortisol, testosterone also. I think this is the part of the issue with so many people having gallbladder dysfunction and having to have their gallbladders removed, is there's so many chemicals in our environment, and you've got if people have a genetic disposition to gallbladder dysfunction. Genetics are really important here. So genetics dictate how enzymes metabolize hormones using a variety of pathways and organs. Certain variations in gene expression, called individual single nucleotide polymorphisms, SNPs, can upregulate or downregulate enzyme activity that affects detoxification. So I do some genetic testing, and I look at gene reports for people. And so that's a little bit of where I've gotten the information from. You can do that, but what I found is using the techniques that I'm going to teach you guys throughout this class. For most people, we don't need to even look at the DNA. We can just use our palpation techniques and our TCM diagnosis and different things, because I end up treating them the same way anyway. So unless I'm stuck and I can't get a person where they need to be, we don't really need to look at the DNA. But if you like that kind of stuff, and I tend to, you can always do that. I always ask too if they're like family members, especially women, their mother, aunts, sisters have had any endocrine cancers, any autoimmune endocrine disorders like Hashimoto's thyroiditis is autoimmune in the endocrine area. That's very common. So I'll ask people if they have that. I ask them, you know, if their parents had any problems conceiving. But the problem is, again, because we're being exposed to so many chemicals generation after generation after generation, that some of this stuff didn't affect the previous generations. So sometimes it's helpful and sometimes it's not. Acupuncture, herbs, nutritional supplements, essential oils, and certain foods can further upregulate or downregulate enzyme activity to influence hormone metabolism. So this is where we're coming in to help people's detoxification pathways work better. Phase 1 enzymes in the lung, liver, intestines, and kidneys begin detoxification by oxidizing, reducing, or hydrolyzing hormone metabolites, drugs, and chemicals. So these are our 4 organs of detoxification that we're going to be going through very carefully in this class. We're going to look at different aspects of the lung, the liver, the intestines, and the kidneys. The following enzymes contribute to phase 1 detoxification: aldo keto reductase, carbo oxa. Oh, I'm just not the best with these long words, guys. Carboxylestrases, cytochrome P450, monooxygenase, and eposide hydrolase. We don't need to know that. You really don't need to know that. But if you see it, especially the cytochrome P450 pathways are really common to be talked about in Western medicine. These are the enzymes that contribute to phase 1 detoxification, but we don't really need to know them. Phase 1 enzymes change the structure of hormones, chemicals, and medications from fat-soluble to water-soluble, resulting in free radicals within the cell. So basically, a free radical is something that creates a lot of inflammation and is toxic to the cell. So the process of detoxifying in itself is toxic, and it creates a lot of inflammation without even trying to do anything. The free radicals are unstable molecules and can damage cells while waiting for the second detoxification phase. Phase 2 enzymes transform the intermediate hormone metabolite into safe, water-soluble compounds ready to be released from the cell. So remember, we've got phase 1, which basically changes it from fat-soluble to water-soluble, but it sits in this intermediate stage. And in that intermediate stage, it's very toxic, it's very inflammatory. So if you see a lot of people that have a lot of inflammation, and we're going to talk about that, how to identify it and work with that, they could have an issue with the intermediate metabolites being toxic there for too long and lingering for too long. And then the phase 2 enzymes come in, grab that intermediate metabolite, and then create it to transform it to a water soluble to be released from the cell. There's 6 different families of enzymes that bind additional water molecules for the release of the used hormone metabolite or the toxin through bile and urine. These are kind of important to know, and these will show up a lot in people when they're doing different types of functional medicine testing. So you might want to be familiar with these. And we are going to talk a little bit about a couple of these throughout this class because they are very important. So we've got glucuronidation via glucuronic acid. We've got sulfation via sulfate, glutathione conjugation, glutathione conjugation, glycination via amino acids, acetylation via acetyl group, and methylation via a methyl group. So some of these are going to come up throughout this class just a little bit so you understand what supplements to give people and why. The cytochrome P450, the CYP family of enzymes, metabolizes pharmaceuticals, and research provides insights into hormone detoxification, especially estrogen. That's why we know so much about estrogen detoxification, is because the drugs and pharmaceuticals all use the same pathways. And that's one of the reasons there's not a lot of research on the detoxification of progesterone, testosterone, cortisol, and the androgens, because it uses a different pathway that the medications aren't known to go down. So we don't have as much information there. But we do have a lot of studies and information from a Western perspective about how hormones detox because of the pharmaceutical companies. The CYP enzymes detox hormones, drugs, caffeine, tobacco, and the toxic byproducts of mold and fungus. Certain medications, including oral contraceptives and quinolone antibiotics, can reduce CYP activity and compromise phase 1 detoxification. So there's a lot of issues with clients now having high levels of mold, candida, and fungus, especially in my area, because I live by a couple of lakes, and the lakes are very toxic, and it has a specific kind of bacteria that's a mycotoxin that acts like a mold and a fungus. And I do know that they believe that mold and fungus is also a contributor to autism and people being on the spectrum. So do you guys have a lot of issues with mold in your area? I'm just curious how many people are seeing mold issues. And it says, what do you mean by symptoms with caffeine? Like, what do they report? So, right. So if they have a problem with caffeine, they'll get really jittery, or they'll end up with, like they don't sleep very well. They have insomnia. Even if they just have the coffee first thing in the morning, if they're a slow metabolizer of the caffeine, it will affect their ability to go to sleep at night. And usually if people say, yeah, I can only have like a coffee first thing in the morning, otherwise I can't sleep, they're probably a slower metabolizer of coffee. And that would be creating the problem. And then also when people try and come off coffee and they get headaches, because their body is adapted to the coffee and it's affected the vasoconstriction and vasodilation, they usually have a sensitivity to caffeine also, but the body has offset that by adjusting the vasoconstriction, vasodilation, but they still usually don't do that great with caffeine. They're better off without caffeine. All right. So, and then also too, so many women that aren't cycling correctly when they're younger, they're just put on birth control pills. And then that just makes everything worse. And it creates even more patterns of imbalance. The case study we're going to look at later today, the doctors, because the girls weren't cycling, they tried to put them on birth control pills, and all their other symptoms got worse. So if women feel sick and nauseous, they have liver symptoms, when they're on birth control pills, or if they get headaches, moodiness, irritability, anxiety, all those things when they're on birth control pills, that usually means they have compromised detoxification pathways for estrogen. So they're more at risk for the complications of the endocrine disrupting chemicals and the blood states and those things. It's like a double whammy for them because they don't detox it right, and then they get more symptoms from it. And then this is where some people who really struggle with IVF, when they're put on birth control pills before a stimulation cycle, they need help with these CYP pathways. So always find out how women responded to birth control. Supporting phase 1 detoxification pathways may benefit people with symptoms of irritability, headaches, dizziness, nausea, or vomiting from medications or oral contraceptives, leaf mold allergies, or sensitivity to tobacco smoke and caffeine. So think phase 1 detoxification for anybody who's had a problem with birth control pills, or they tend to have headaches, nausea, leaf mold allergies. Leaf mold allergies are huge in our area. And I think it's just getting worse. I think this could be one of the contributors to people having a lot more allergies today, is these detoxification pathways being compromised. So drug interactions can occur because pharmaceuticals disrupt and overburden the detoxification process by upregulating or downregulating the CYP enzymes. Genetic variability of CYP is also a significant source of unpredictable drug effects. Most of the people that seek out acupuncture and holistic medicine, they do so, a good portion of them do so because they don't do well with Western medicine, and they have a lot of side effects from medications. So I think our population base in general is at a much higher risk for problems with these phase 1 enzymes. And that's why they seek out holistic medicine, because they don't do well with just taking a pill to take care of their symptoms. Otherwise, most of them wouldn't even come to see us there. Just checking in the chat. Let me just check and see here if there's anything else I need to look at. Yeah, I'll go back through the chat. Oh, here's some things. What were the symptoms of not doing well on birth control? Yeah, so this is it. So a lot of women not doing well on birth control will get nausea, headaches, dizziness, those types of things. And some of them even vomit from being on birth control. So every time a 12-year-old girl has some period-related pain, immediate birth control prescription. Yeah, that's a problem. And that's what we're going to see in the case studies today. 2 young teenagers that their mother brought in after they didn't do well on birth control. So I'm also seeing women using Depo or hormonal IUDs who are no longer bleeding. Yeah, so this is a big problem too, is the hormonal IUDs, the progesterone-based IUDs. I have quite a few women that have gone through menopause, and they left those IUDs in producing progesterone as they went through menopause because they thought it was going to make it easier for them. And then they have a lot of issues with the hormone detoxification pathways. And they're usually people that don't respond well to hormone replacement therapy either. And the Depo. Yeah, so you really got to do some pretty intense detoxing. If you have women that have created amenorrhea through birth control, so they're not getting a period, you're going to want to do like 2 to 3 months of more aggressive detoxing and ask them to not try and conceive during that period, because the body's going to be dumping and releasing a lot of the stored built up old hormones and probably endocrine disrupting chemicals mixed together. And when the body does a more aggressive detox for like 2 months to get all that out, sometimes there's the circulating toxins, and you don't want to get pregnant during that time and expose the embryo to those levels of used hormone metabolites and toxins. So you'll definitely want to do a longer detox for those people. Let's see. Yeah. Okay. So where are we at on time? Okay, we just do one or two more slides and we're going to take 15 minutes. Phase 1 enzymes. The CYP enzymes control most the CYP enzymes control most estrogen detoxification pathways. The aldo-keto reductase, the ARKs, include 5-alpha reductase and 5-beta reductase enzymes, and they manage most progesterone, cortisol, and testosterone detoxification pathways, and they synthesize bile produced in the liver. How many of you guys are doing Dutch urine testing for hormones? This is where you're going to see these terms. So this is why I wanted to bring it to your attention, is if anybody's doing the hormone panel through, I think it's Precision Analytics, they do the Dutch testing, which is considered a gold standard for hormone detoxification pathways. And I usually, actually, all my women that I have going through menopause, I have them do the Dutch test. And so this is where you're going to see this information is on the Dutch test. Q&A. Would it be helpful to consider phase 1 detox for women who have the same symptoms of nausea, irritability during their periods, even when not on birth control? That's a great question, Jennifer. So she's asking, is it helpful to consider phase 1 detox support for women who have these symptoms of the estrogen detoxification pathways being compromised when they're just on their period and not on birth control? And that is a hallmark sign of somebody who's got compromised detoxification pathways, is they'll have all these symptoms flare up right before, during their period, because that's when the body's trying to detox the old hormones. So right before a woman bleeds, there's the release of the hormones, and they are needing to be detoxed as used hormone metabolites. So they'll get a lot of the symptoms just a couple days before their period starts, with like constipation, loose stools, diarrhea, nausea, headaches. Like all those symptoms are symptoms of compromised detoxification pathways. And that's when you'll see it. It's the most obvious when a woman is just about to start or on their period and they're bleeding. That's when you'll know how well you're doing too, because you should be able to see those improvements occurring pretty quickly from having to make some basic lifestyle changes and doing the detoxification protocols we're going to talk about. Okay, so I think this is a good time. Yeah, this is a perfect time to take a 15-minute little break here. Get some refreshments. I'll go back through the webinar chat, make sure I didn't miss anything too, and look up a couple things. All right, so do we need to do anything for 15 minutes on this side? Okay, oh good, I'm glad you're enjoying this class so far. All right, so we will resume in 15 minutes, everyone.